As point-of-care ultrasound becomes more and more popular and it's adopted in more and more pediatric emergency departments, there seems to be a growing concern about what is the scope for the pediatric emergency doctor. Is the pediatric emergency doctor in danger of becoming a radiologist and spending lots of time just scanning, or becoming like a cardiologist and looking at congenital heart malformations? Well, of course, we know from the emergency perspective that this is ridiculous. That what really defines point-of-care ultrasound for us is its impact on our workflow. And what I mean by that is that we always have more patients waiting in the emergency department. That means that regardless of how great a technology is, if it slows down our workflow and we're not able to see patients in a timely fashion, then it's just not going to be adopted and it's just not useful. And so when people are concerned about our scope growing, our scope can only grow in the context of what our workflow allows. And I think this is important to remember. It's important to remember that we can do lots of complex things. We can do lots of impactful things. But if those aren't contained and aren't, compatible with our workflow, they're never going to be useful and they're never going to be adopted. So when you think about point-of-care ultrasound and how it can impact your practice, remember that the applications that you're going to use in your particular setting have to work with your workflow. And if they don't, then you should look for alternatives.